I think, in my opinion, there are three main issues with management of hemophilia. First is the diagnosis. Like in Thailand, I think there is no much issue with that diagnostic test, but in several countries that they cannot access for the factor 8 or factor 9 level, so it's quite difficult for them to determine which patient whether or not they have hemophilia and which type of hemophilia that the patients have, and also the inhibitor issue after they start the treatment to the patients as well. So that's the first challenge. And the second thing is the access to the treatment. In the past, even in Thailand, we had some difficulties of using factor concentrate. We previously used plasma product and cryoprecipitate to treat hemophilia patients. So with that kind of treatment, it's quite difficult to put the patients on the standard treatment, which is the prophylactic treatment as we have now. But right now, because in Thailand, we have the access to the factor concentrate, and because of the pioneer in hemophilia field in Thailand, they develop low dose regimen. So it can be applied to many low income countries if they have limited budget for the factor concentrate. Right now, they can put the patient on some kind of prophylaxis, which is much better than keep the patient just on the on-demand treatment. And the last issue, I think, is the big issue, not even in the low-income country, even in the middle or high-income country, which is inhibitor. For the low-income country, it's quite difficult, as I mentioned before, about the diagnosis of the patients with inhibitors. Also, because of the treatment for the bleeding for patients with inhibitor, which is for high data inhibitor, which is the bypassing agents, which is much more expensive than the factor concentrate. So it's very challenging because first is to treat the acute bleed in patients with inhibitor is more difficult because of the expense of the expensive products, and also to keep the patient on the prophylactic treatment, which is much more difficult. Right now, I think it is better that we have the non-factor therapy, but we also face the same issue with the treatment of acute bleeding because that kind of treatment is much more expensive than the factor concentrate. Also, the same thing, I think there are several studies that try to mention about using low dose regimen of the imicizumab can be used for prophylaxis in low income country. So I think in low income country, we cannot follow the regimen from high income country directly. We have to adapt and make our own protocols and prove it by doing some study and publish it to make it confirm the concept that this kind of low dose treatment is work and it can be applied to other low income countries as well.